Do you suffer with migraine headaches? Well, you're not alone. Millions of people suffer from these debilitating headaches. And the problem is that they all keep getting the same treatments. You go to the same doctors, or different doctors, it doesn't really matter, but you get the same kind of treatment. Medicine, if the medicine doesn't work, shots, if the shots don't work, you have to fight through it. Now, what kind of science is that? I'm sure when you ask the doctor, Doc, why do I keep getting these migraines? The answer is usually, well, it's because of your blood vessels. Well, blood vessels could be the problem, be one of the problems, but there's only over 50 different reasons you could be having these migraine headaches. And it's not the same for everybody. You've got to delve into what's going on and get to the root of the problem. Because I'm sure you've thought, hey doc, or said to them, hey doc, isn't there anything else you can do for me? Every time I come in here, you do the same things. If you go to another doctor, emergency room, you keep getting the same treatments. Yeah, they might help the symptoms at the time, but they don't stop the progression of the migraine, or if the migraines get more frequent. You've got to wonder what in the world is causing these. How unlucky am I to keep getting these migraine headaches? And that's what I'm here to tell you, that you are not unlucky. There's just certain things that have not been done for you to find out the real reason why you're getting these migraine headaches. Migraine headaches are dynamic, they're complex. And you, being a dynamic, complex person, need a doctor who understands this and looks at the migraine in a different way. A doctor that will go in and leave no stone unturned to find the reason that you're having these migraines. So I use my extensive background in functional neurology, functional endocrinology, and functional blood chemistry analysis to get to the root of these problems, to find out what the problem is. See, one of the things that I would do is we would run a complete blood chemistry panel with extended thyroid panel. We want to find out what's going on in your system. We want to check things like your blood sugar. You see, blood sugar is very important because blood sugar regulation, if it's dysregulated, causes problems with the neurons. See, your cells, every cell in your body needs two things to function: fuel and activation. The fuel we get is from the food that we eat and the oxygen that we breathe. The fuel that goes into our system gets broken down into glucose, and glucose gets delivered to the nerve cells and every other cell. Now, if your glucose levels are not optimal, and optimal range is 85 to 99, now that's not the normal range. The normal range is way wider. It's like 70 to 100. But see, normal ranges are very wide because they get a lot of people in there. See, normal just equals sick. Back in the 50s, normal ranges were what we are talking about now, functional ranges, which are much tighter. We want you to be optimal, not just normal. Normal people die at the age of 78 years old. We don't want you to die at the age of 78 years old. We want you to live. So we want to look at your blood sugar. See, if you have too much blood sugar, that's hyperglycemia. It causes nerve cells to become inflamed and causes them to die. Too little blood sugar, hypoglycemia, well, there's not enough fuel to get to the blood, to the nerves to have any activity, so they die. And if you're unfortunate to go in between both of them, hyper, hypo, hyper, hypo, then you're dysglycemic. And dysglycemia causes nerve cells to become unstable and it causes them to die. So it's very important for us to look at that. Another thing that we would test to see that was we would test your adrenal gland function. See, the adrenal glands are very important in regulating the blood sugar. They work hand in hand with the pancreas and insulin. So we want to find out if that is what could be causing the problem, or if they could all be causing the problem. We want to get to the root of that. We want to see if you're anemic. Anemia just means that you're not getting any oxygen to your cells. Now, anemia, if you're anemic, you'll never get well, and we've got to find out why you're anemic. So see, there's a lot of things that we look into to find out what's going on. We check for food, protein reactivities. Some people react to certain foods that they eat, and those reactions cause an inflammation in the central nervous system. And once the brain and the central nervous system become inflamed, and you have an immune system response, well, all kinds of trouble can break out. And it could kick into what we call an autoimmune condition. And that's a big one. And research shows that a lot of causes of things like migraine headaches and chronic conditions like this are from an autoimmune condition going on in the body. And what that basically means is that you are attacking your own cells. And with migraine headaches, you could be attacking your brain cells and different parts of your brain, your cerebellum, your upper brain. You could be attacking your oligodendrocytes, a lot of different things. And we want to test and see if that's the problem, if that's what's going on. Because if you have an autoimmune condition, that trumps everything else, because we have to get that under control so that you can heal. I've had a lot of patients with that problem that had migraine headaches since the young age. I have a patient from the age of 3 years old, had migraines all her life till the age of 36, and then we eradicated them. She'd been through the gamut. But once we found out what the problem was and got rid of it, the migraines just went away. If you're watching this video on my website right now, you know you're not happy with the current treatment that you're getting. You know that it's frustrating to have to go every week, every month, every couple of days to get shots, to get medicine, things that don't make you feel right. It's the same thing that you're getting over and over. And there's a definition of insanity that goes with that. A person doing the same things over and over, but expecting a different result. Well, it's just not going to happen. If you keep doing the same things, you're going to get the same result. I hate to say it like that, but you need to understand that. Now, the reason you might be going to those doctors over and over is because they are on your insurance program. Well, I'll tell you this. Insurance is not really the greatest thing in the world for healthcare. It's good if you are the doctor getting the insurance, but if you're the patient and you have a chronic condition, now it's good if you have a heart attack or if you have some kind of other thing, but if you get a chronic condition like these migraine headaches that nobody knows how to fix, well, they're not going to go out of their way to try to learn new things to do because they're getting paid anyway. And the more times you come in there for those migraines, the more money they make. We don't believe in that here. We want to get you well and give you an exit strategy so you don't have to stay in here or go to doctors all the time. And that's what I strive for. So just don't give up. Don't get frustrated and give up, because there is a new hope. I'm here to offer you that hope. So that's what makes me different than all these other doctors. I look at you in a different way. I look at your migraine headaches in a different way. I want to look at you in a functional, a neurologically functional approach and a metabolic approach, because every system relies on every other system. You can't just have a migraine headache. It's physiologically impossible. You have to have something else going on in your body to trigger that symptom. And that's what we want to find out. How could the same treatment for 29.5 million Americans work for everybody? It doesn't. Because if it worked, there wouldn't be so many people out there searching the websites, looking for a cure or looking for somebody to help them with their migraines instead of just taking medicine all the time. Let's get real. We want you to be cured. We want you to be well. We want to give you the optimal chance at being the most human you can be and not have to not be able to do things because of your migraine headache, not be able to play with your children or your grandchildren, not be able to go to work, not be able to go to school, not be able to be happy. So all that was a part of my metabolic approach, but what am I going to do neurologically? Well, we're going to do a functional neurological assessment, a complete neurological assessment. And I'll guarantee you, after all these neurologists that you've probably been to and doctors, you'll never have gotten a test like the exam like I'm going to give you. So we want to find out what is the root. And we want to look at you neurologically. We want to find out what's called the longitudinal level of the lesion. Exactly where is the problem? Is it in your brain? Is it in your spinal cord? Is it what part of your brain? Is it in your ocular system? Is it somewhere else that nobody ever even looked? We're going to look. I get the amazing results that I get because of my background in functional neurology, functional endocrinology, functional immunology, and functional blood chemistry analysis. With these sciences put together, there is really nothing we can't find out about your system. Look, if you want to find out more about what we do here, sign up here on this page. Get more information from us. See when we're going to offer another a workshop. We offer workshops, migraine headache workshops, free. The seating is limited when we do them. They're usually packed. But we offer them so people can really see what goes on and learn what could cause you migraine and how to fix it. No two migraines are the same. No two people are the same. Aren't we like snowflakes? Look, everything that we do in our life is resultant of what we do. If you keep going to the same doctors over and over and you're just getting the same results, well, you can't really blame the doctor. That's just what they're doing. They're there to make money, I'm sure. You have to blame somebody else. You have to look at yourself. You're too important to waste your life this way. You know, the happiest days, this is a quote that I saw, the happiest days of our lives are the day that we find out that we are the reason for our problems. We stop blaming our mama. We stop blaming the president. We stop blaming the environment. And we look at ourselves and say, I am the reason that all this is going on. Now, you might not be the reason that you have the migraine headaches. But if you don't act and make a decision to change your life and find out what's really going on instead of going around like on a conveyor belt over and over, well, you can only blame yourself. Now, I hate to be blunt like that, but sometimes people have to talk like this because people are out there suffering and not doing anything about it except for getting the same old treatments. Sometimes no treatment because they get frustrated with it. And I don't want that to happen. It's been a pleasure spending this time with you, and thank you for spending your time with me. Sign up here on this page. We'll get you some information out. We'll get you information about the next workshop. I might be even offering some trial visits, 2 free visits. Fill it out and we'll contact you, okay? Thank you again.